my jurisdiction is not just in Senate District 29 in El Paso County, but also Hudspeth, Culberson, Jeff Davis, and Presidio. A vast jurisdiction, vast territory. Those other 4 counties are rural areas. And of course, we have some rural areas here in El Paso County itself. So I want to start off by saying that many of us are immigrants or first-generation citizens. And so that means that we require a specific cultural sensitivity when it comes to dealing with issues. In our area, unfortunately, we do have an overall low income, but a strong and yet stretched network of family connections. When you hear about people talking about family values, family ties, strong families, we have them in this community and have for generations. This is a resilient community that lives in the desert, distant from Washington, from Austin, having to depend on themselves and on their families and their community members to survive and to get ahead in life. And that distinguishes us from many other parts of the state and this country. As community members, of course, we are very rightly proud of El Paso and the role that it plays as a gateway to the United States for people, for goods, services, commerce. But unfortunately, our community is not always understood by other Americans throughout this, even in this state, but certainly throughout this nation of ours. As you know, there are some political leaders here in the state and even at the national level who play on that lack of knowledge. They feed inaccurate perceptions about the border and border life, and with half-truths and outright lies in many cases. At the state level, when we face policies that hurt our community, such as broken school funding system, or cutting instead of expanding access to health care, as just mentioned, we in El Paso speak up and we stand up and work for our own best interests. And that's the way it's always been. Now, over the past several years, we've seen anti-immigrant proposals in the Texas legislature that range from denying in-state tuition to Texas Dreamers, those young people that were brought here when they were kids, and many with disabilities that lack health care access. Now, you may be wondering, why am I opening up this talk with you with these kinds of comments? And that's because I think that these attitudes and policies impact us negatively as a people. The real-life implications of trickle-down discrimination become apparent in people who need help, the kind of help that you dedicated yourselves to provide. I can't emphasize enough how important you are to our community, to this state and this country. Although resources are limited, our region is blessed by people who care deeply about their fellow human beings. Those of you who are here help people overcome some of life's most difficult challenges. Poverty, discrimination, abuse, addiction, physical and mental illness, divorce, unemployment, and many other issues. I know that you work most of you in the front lines, providing direct service as directors, as managers, as supervisors in government, nonprofits, and other health and human services settings. And those of you who are social workers are uniquely trained to assess, diagnose, and treat a client, addressing all aspects of a problem as an effective means of overcoming unseen barriers. You play an important role in bridging the gap between the person who needs help and the services that are available, and in trying to even bring new services that aren't available. One area of tremendous need that I always speak about, that Ms. Moya just referred to, is access to health care. This is a priority for me, for my office, and in my opinion should be a social priority. Often it means that the resources simply are not there to serve the needs of the community, as you probably found out when you were out of the colonias. But lack of access can also mean that while the service was available, members of the community were not able to connect with a provider. And so you play a key role in establishing that connection. Now, this can be for many reasons that you all know about. For example, in our colonias, are communities that are physically isolated from developed areas of the city and are far from major service providers, many people without access to transportation. And as you know, people tend to speak in Spanish and for cultural reasons may be hesitant to entrust their personal problems to others. Barriers to access to healthcare also include transportation, affordability, fear of missing work because you're going to get fired, and of course to that you can add the shortage of health professionals. So what does the struggle for access to healthcare consist of? Here are some items, and we brought it up already. We must expand Medicaid and increase provider reimbursement rates for all providers, not just the doctors. Here in El Paso, in terms of expanding Medicaid, prior to the opening of the marketplace under the Affordable Care Act, by the way, the federal exchange, because Texas refuses to establish a state exchange, but prior to that, we had about 176,000 community members uninsured. Only about 26,000 qualified for the subsidies to buy plans in the marketplace. That left 150,000 without an affordable health insurance option. And because our state leaders refused to expand existing or traditional Medicaid program, I filed a bill called the Texas Way, a private insurance exchange. That's what it would be. Something that has been established in states like Oklahoma, Arkansas, Arizona, and places that didn't want to participate in the Affordable Care Act exchange. They set their own insurance market. This bill would have authorized the Health and Human Services Commission to apply also for a Section 1332 waiver. Some of you may be familiar with that. I know Leti Paez is, and she knows everything and all things health in the healthcare. This type of waiver is, of course, included in the Affordable Care Act, and it provides yet an opportunity to extend coverage to those who don't have insurance coverage. It would provide coverage to over 1 million plus low-income Texans that are uninsured. And you probably all know that Texas is the state with the highest rate of uninsured in the nation, over 5 million people. In fact, our businesses, including the Chamber of Commerce, the Texas Hospital Association, and others, were strong proponents of this bill. But unfortunately, we're in Texas. For those of you who are not from Texas, and those of you who already know it, in this case, we didn't even get a hearing in committee. Now, we also need to increase the reimbursement rates. Lower rates paid to doctors in El Paso and along the border is something that we need to fix, because it impacts not only access to health care, it addresses the question of shortage of healthcare professionals, because to the extent that doctors in a heavy Medicaid population don't get paid fair rates, they shut down their practices to the Medicaid population, or they move from El Paso, as has happened many a time. So whatever form it takes, I can't stress enough to you how important it is that we find a solution that will allow us to accept billions in federal taxpayer dollars, our dollars, to provide affordable health care. There is simply no good reason for Texans to suffer from lack of health care, or for local governments and local taxpayers to continue bearing the burden of uncompensated care. Now look, here in El Paso, since 1990, when we first envisioned having our own health science center, our medical school and health science center that we have now, we've been interested in promoting access to health care, affordability, and quality in our region. Our community happens to form the largest international metroplex in the world, right here in the Paso Juarez region, southern New Mexico, with a combined population of over 2 million residents. This is a binational, bicultural community that gives social workers a unique perspective on what they do. It is truly offers unique opportunities and unique challenges. I mentioned the healthcare professional shortage. We have a strong and advanced social work program right here in El Paso. And for those of you about to graduate or just starting that career, I hope that you have the opportunity to stay in El Paso. We always complain about our brain drain here. But we have so much need that we would like for you to stay in El Paso. We know that nationally the behavioral health field loses 18% of professionals every year. And a great generation of social workers is also poised to retire. When we have a single healthcare professional overwhelmed by stress and pressure, leaving their career, the cost is more than the tens of thousands of dollars. And by the way, I understand that the training for a caseworker with CPS is about Child Protective Services in Texas is about $50,000. And yet we have high turnover rates every 2-3 years. Institutions lose invaluable clinical experience, and the patients, of course, lose a valuable source of healing wisdom. Now, colleagues, too,